Hi guys, this is Dr. Elbert Cheng. I'm board certified facial plastic surgeon, and today we're going to talk about something that I really love to do. It's one of my favorite surgeries. I think in eyes in particular, there are very nuanced things that I've learned over the last 22 years that I think are very helpful in outcomes for my patients. When I first started out, I was trained in doing eyelid surgery, and we would make an incision under the lashes. So it's called a subciliary technique, and we would go in and find the fat, which is fairly easy to do. It's just underneath the orbicularis oculi muscle of the eye, and there are really essentially three pockets to the fat, and you remove them. On some patients, I got really nice smooth eyelids in the lower eyelid area, and it would improve on wrinkling of the skin because we would lift the skin and muscle, like you're making your bed after you get out of bed. You re-drape everything and you can take care of some wrinkling there as well. So we would improve with contour by removing fat and the wrinkling of the skin and some sagging of the eyelid region, the skin and the muscle layers, by advancing them up and removing them and then sewing everything together. Again, like I said, some patients would turn out really great and some patients would just be a little, hollowed looking. Over the last 2 decades, I've transitioned over to more of preservation of tissue. I think that's the general consensus with surgeons these days, is you don't want to really remove fat because for most patients, most people, you would hollow out as you get older. When you do get older, what's not really known to everyone is that your eye socket, the bone, the room that holds your eyeball actually expands in different dimensions as you get older. So your eyeball changes shape, the fat around your eye changes shape, the tissues around it loosen because the room expands out. And so that's what creates some of the aging features. So if you take fat away from that space with the room that expanded out, you can see why maybe it would hollow in. So now, in order to preserve structures, the support system of your lower eyelid, I do think it's a much better technique to go from inside the eyelid, what we call a transconjunctival approach. I find the fat pockets and then we reposition them in different ways. You can position them over the bone, over the muscle, under the muscle. I think it's better to position them under the muscle. There are lots of muscles of the lower eyelid. Position them so that it creates more of a smooth contour. Hands down, the best approach. Now, how do you address loose muscle? I don't find loose muscle is that big of a deal, but the loose skin is a problem sometimes. So then you can still come from the outside and tuck up the skin and help with skin. But after that's all sewn up, and again, my outcomes are so much better now, you can add different things to the lower eyelid fat repositioning technique, whether you go from inside or from the outside. You can use CO2 lasering on the surface of the skin to help with basically smoothness of the skin and building collagen. You can add fat from your body in the eyelid area, and there are definitely ways to do that safely with cannula techniques. You can also adjust the corner of the eye with different techniques, canthoplasty, canthopexy, and other things. So there are a lot of nuances to lower eyelid procedure that can change the way you look in very powerful ways. But I'm just sharing with you some of the things that I love to do now with lower eyelid surgery. And if you can include in the comment section any procedures that you'd like to hear about, that would be fantastic. So subscribe and like, and we'll talk to you next time.